When performing an abdominal exam, have the patient gowned and draped. Use the correct terminology for locations on the abdomen for consistency in reporting findings. Always begin the exam by asking the patient to identify any areas of pain and examine that area last. When inspecting the abdomen, always observe the abdominal contour. Look for any striae, hernias, vascular changes, lesions, or rashes. If scars are present, inquire about their origin. Also look for pulsations or peristalsis. Begin your auscultation by listening for bowel sounds. Using the diaphragm of your stethoscope, listen in each quadrant until bowel sounds are heard, or for 1 full minute. Report sounds as increased, decreased, or normal. Continue auscultating with the diaphragm over the abdominal aorta, listening for bruits. Move laterally to auscultate the renal arteries. Make sure to compare side to side. Move to the lower quadrants to auscultate the iliac arteries. If present, a bruit sounds like blood rushing through a small opening. Percuss in all 4 quadrants and the midline of the abdomen, outlining areas of dullness and tympany. This helps to identify enlarged organs, masses, or fluid present in the abdomen. Next, percuss the liver span in the right midclavicular line. Begin percussing over the lower thorax and percuss downwards until tympany changes to dullness. This is the upper margin of the patient's liver. Continue percussing downwards until dullness changes back to tympany. This is the lower margin of the liver. Note the liver span. To test for splenic dullness, place your finger on the last interspace in the left anterior axillary line. Percuss. Then ask the patient to inhale deeply and percuss again. A decrease in tympany may indicate an enlarged spleen. Mainly using the pressure from fingers on one hand, lightly palpate all 4 quadrants and the midline of the abdomen. Ask the patient to identify any areas of tenderness, but more importantly, observe the patient's face for signs of discomfort. Using both hands, palpate deeply in all 4 quadrants and the midline of the abdomen. Warn the patient that this part of the exam is normally uncomfortable. Feel for any masses or organ enlargement. To palpate the liver, push your fingers under the bottom of the rib cage in the right midclavicular line. Ask the patient to inhale deeply and feel for the lower margin of the liver. Palpate deeply over the abdominal aorta, observing its prominence and its strength of pulsations. Also, determine the width of the aorta. This is generally easier to assess in older patients. While you are on the patient's right side, lift the patient's left flank with one hand while palpating the left costal margin with the other. Ask the patient to inhale deeply and continue palpating for the tip of the spleen. It is palpable in a small percentage of normal adults, but usually suggests splenic enlargement. Rebound tenderness tests for peritonitis. Slowly press down on the side of reported pain. Quickly release pressure and ask the patient if it hurt more when you press down or when you let go. Note if pain was felt in any areas other than where you tested. The liver scratch test is used as an alternative or to confirm the results of a percussed liver span. Place the diaphragm over the upper margin of the liver. Lightly scratch the skin over the lower abdomen and move upwards until the sound is magnified by the mass of the liver. This point is the lower margin of the liver. Costovertebral tenderness may be a sign of pyelonephritis. To assess this, place one hand over the costovertebral angle. Warn the patient that you will be jarring them. and smartly pound your hand with your other fist. Observe the patient's face for signs of discomfort. Repeat on the other side. Assessing shifting dullness is a test for ascites. With the patient on his or her back, percuss from the midline laterally to the first point of dullness. Mark this point. Now, ask the patient to roll on one side. Again, percuss from the midline laterally to the first point of dullness. If, as in this patient, the 2 points differ, ascites may be present. The psoas sign is a test for appendicitis. Ask the patient to raise his or her right leg against your resistance. Pain may indicate appendicitis. Testing for the obturator sign is another test for appendicitis. With the patient's knee flexed slightly, raise and internally rotate his or her right leg. Pain may indicate appendicitis.